Millions of pregnancies end in miscarriage every year. Whatever the cause, the loss leaves a huge hole in the hearts of families. October is Pregnancy and Infant Loss Awareness Month, and we wanted to talk about this painful topic and small ways we can ease some of the pain. So we have Dr. Karyn Gordon with us. We have Dr. Marjorie Dixon with us. And, you know, we have some stories here that have really just brought this story home for me, and I think it will for you as well. A huge thank you to Pregnancy and Infant Loss Network at Sunnybrook. That's where we got this story from. So I'm not going to reveal who it is, but here is her story. We had the car packed up because we were going to my cousin's birthday party. Sitting there and playing with my phone, I suddenly couldn't remember the last time I felt my baby move. I was 24 weeks pregnant. I called my doctor's office, and I remember telling the nurse how I was feeling, and the crying started. She said, you should head to the hospital just so they can do an ultrasound. Once in a hospital room, they checked for the heartbeat. There was nothing. During the ultrasound, I remember saying out loud to myself, I lost this baby, he's gone. The doctor came back to my room and said, unfortunately, I don't have very good news. My heart sunk. I felt like someone had punched me in the stomach. We had to call our immediate family to tell them the news. I can still hear my husband calling his parents and two sisters and crying. We have some sad news. We found out we lost the baby. They induced the labor and I delivered my baby. He weighed 406 grams. I needed to hold him and see him. I'm so happy I did. He was so beautiful. I held my baby boy tight, and I remember looking down and telling him how much I loved him. Everything about him was so beautiful. I don't know how to deal with the pain of losing my child. I feel like life has to go on, but how? How can I get back into my daily routine without him here? We had so many plans. My heart is broken. I know they say time heals, but how can you heal a piece of your heart missing for the rest of your life? So if you ever hear the words pregnancy loss, and then you associate it with a story like this, it just hits, you know, it's gutting. And I think that what a lot of people don't realize is that this is pretty prevalent, is it not, Dr. Dixon?
So pregnancy loss can happen in early pregnancy. That is more common. It is less common to have a second trimester or mid-trimester loss, so after 20 weeks. But it is devastating. It's something actually I think that a lot of people don't know can happen. Yeah. And so that's why it's so devastating. I mean, the story, you can't imagine. I mean, I'm a physician, and so I've had to deliver this news. And it's unimaginable. And everybody deals with it a little bit differently, but the first thing I always say is that nothing that you did made this happen.
Because women blame themselves, don't they?
Women take it on and carry it, and it makes it very, it makes them feel broken, even though it is something that happens and is mostly out of the control of anyone. Your physician, you as a patient, your partner. And it takes people, it's a mourning, right? It takes a long time, sometimes years, to get past this experience. And you know what's hard is, as a physician, then you actually have to prepare the patient for what needs to come next.
Which is, you have to have the baby come out, you have to deliver the baby. That is so tough. And you mentioned the spouse, the partner, and I want to bring Dr. Karyn into this, because if you are a partner, if you are a family member, and you see that this person is broken, they've gone through this grief, what do you say? How do you help?
This is such a painful topic.
It's a tough one. It's a tough one.
One of the things you don't say is, well, let's just try again.
Yeah.
Let's just try again, or you've got other kids.
Yeah.
Right? You know, all of a sudden we're kind of downplaying it. And honestly, I mean, life is precious. And when we have, you know, it's the greatest gift and it's the greatest loss, right? It's literally the spectrum of emotion. So I think the best thing we can do is just to be there, to hold the person, to hold their hand, to say, I love you, I am here for you, and it's okay to be sad. Yeah. Like, I think you have to allow yourself to grieve it. Because if you don't grieve it, it comes out in weird ways. It can go into depression, it can affect people's sleep, it can affect the relationship. And so a lot of times when I work with couples, I will see like women are just like in this like huge pain, and the spouse a lot of times just doesn't really know how to respond. And so you just need to be there, and not try to fix it, because you can't fix it. You cannot fix it. You can just have to be there and to be present. Say, I am here for you. It's okay for us to be sad together. And I want, if anything, I want the couples to come together with it, because a lot of times the female will be kind of mourning alone, and the guy's like, I don't know what to do.
It's
Get in
interesting
there.
you say
Get in the
that,
trenches.
right?
Get in the trenches. You're both part of this, and you both need to grieve.
Yes.
As you know, I see couples for fertility, right?
Yeah.
And so the other thing is, even when women have losses early, they grieve that substantively, and sometimes that also gets minimized, and the partners don't know what to do. That's why I think it's important. I mean, we actually have support groups monthly.
Grief support groups for
and we're
having
actually
loss.
we're starting actually a series at Inova for 6 weeks, as a support group for women with pregnancy loss. So it's really something that talk in groups, go online, look for networks, find supports. You're not alone.
There is help for you, and we want to make sure that you have that help. We'll have a list of some of the resources out there on our website, cityline.tv.